I'm with Arman Hachdurian, CEO of the National Competitiveness Foundation of Armenia. Hello.
Hello.
What are you discussing this year at the World Healthcare Congress Middle East?
Let me start by saying that it's a real honor and pleasure to be here. And not only in terms of participation, but also in terms of getting exposed to the trends in healthcare policy, transformation, and projects that are going on in this region. Particularly, in Armenia, we're trying to shape the public policy agenda in terms of, let me put it this way, transformational healthcare. It's not really about incremental improvements. It's about putting in place an innovative system in terms of structures, institutions, governance model, processes, the whole 9 yards on the one hand, and on the other hand, making the private sector taking responsibility in participating in delivering healthcare services. But of course, it's like a two-level game. On the one hand, the state has to do what it has to do in terms of regulation, and on the other hand, the state has to make the conducive ecosystem or the environment for the private sector to step in terms of concrete investments into healthcare delivery system, with all the efficiency cost optimization and efficiency consideration attached there too.
Why is it important to have such an event?
First of all, it is important because you can exchange ideas, experiences, and knowledge. Of course, there is no one system that fits all, but the good thing for us, for Armenia, is that we are starting the reform agenda, and we can learn a lot, not to make the same mistakes, not to reinvent the wheel, but to see how you can use the public resources, public money, to create the value added. Because what we see and what we learn across the world is that you cannot have a long-term sustainable system which is based on public finances.
Yes.
So the role of the state is fundamentally changing in terms of provision of healthcare services, from the role of the financer to the role of the enabler in terms of creating an enabling environment for patients, for customers, and for businesses.
And what are some of the challenges your organization is facing in the healthcare industry?
Basically, the fundamental challenge, I would answer to that question at three different levels. First, it is in terms of clarity. Clarity in terms of reform and priorities, in terms of structuring, and in terms of responsibilities. Because if you want your journey to be effective and efficient, you have to have that clear vision as to where you want to be and how you want to be there. The second one is basically about engagement, because you cannot take your journey unless you communicate and engage all the stakeholders, unless you shape a common agenda and common responsibility. And then, at the third level, you need implementation. You have to implement your reform, and you have to deliver the results. But to deliver the results, first you need very strong commitment, and second, I mean, we talked today a lot about leadership. But to me, sometimes the stress is not really in leadership. The stress is in transformational leadership, because you can lead a system by trying to improve it. But to put in place a completely new system, you have to have a transformational leader. You have to be one. And you have to engage people, you have to empower people. And you have to give this ownership of reform and the delivery to people.
What are some of the innovations your organization brings to healthcare?
Well, I mean, innovation, it depends how you define innovation. I mean, because we have talked a lot about innovation as well. Innovation in itself, it depends whether you look at innovation as a tool in itself, or an end in itself, or a mean to achieve something. In terms of innovation, what we are trying to bring to Armenia is that innovative thinking, how you put in place a system which is conducive to innovation. Because before you make that innovation effective, you have to have the whole policy framework, the basics in place. And sometimes it's really about the basics. And when you try to create and regulate that ecosystem, then the innovation in that system would be more productive and more efficient. Because even the best innovations in the world cannot work if you don't have the supporting environment.
What do you hope to learn or teach from such an event?
Well, I think, as I said, we are here to learn first, and hopefully one day we can also teach. But we have learned a lot, I would say, and my compliments to Abu Dhabi Health Authority. They have done a significant job in terms of putting a system in place that first can deliver services to the population or to the target, but at the same time to make sure that the delivery meets qualities of standards, or standards of quality, it depends how you define it, standards of improvement, standards of monitoring and enforcement. Because the state has to do, or the authority has always to do with regulation. And when markets can do a better job, market has to be given the chance to do that job. And the role of the state, I believe, like a liberal economist, that the state intervention has always to be kept to the minimal, and the state has to have or be empowered to play only its regulatory role in the markets.
Armand Khachaturian,
Yes.
thank you very much. It was a pleasure speaking with you, and we hope that you enjoy the rest of the conference.
Thank you so much. It was really very interesting and enjoyable.